Hi guys, welcome to the LY show, the Waiting Out COVID-19 series. I'm Ying. On this episode, we continue to talk to people about how they've been coping with this pandemic and how their lives are being affected. Today, we are very glad to have Dr. Dheeban Chakravarthi joining us from India. Dr. Dheeban Chakravarthi is engaged in algal biofuel research. His research focuses are photobioreactor design, algal harvest methodology, and algal growth lipid optimization. Hello, Dr. Dheeban.
Hi guys. Thanks for having me. I heard about your show. I'm very happy to be here, and I think it's very good to have a show like this at this time in the world where getting the voices out from common people is quite difficult. So glad to be here.
Thank you. Our goal is to make a record or documentation of people's life during this particular time. So having someone from an academic background is really amazing. Thank you again for joining us.
My pleasure.
All right, so Dr. Dheeban, where are you at the moment?
So at the moment, I am located in Navi Mumbai, India. It is like a suburb of Mumbai, India.
Mm-hmm. And how's the situation in your area?
It's lockdown here. The lockdown initially was extended, was for 3 weeks. Now it's been extended for another 15, 18 days. So there's nobody really out there on the streets, except for essential supplies. You can't go out. So it's pretty deserted out there. Um, some areas have actually been totally sealed, like they would have to be provided stuff in their houses. They can't even come out, which are deemed to be hotspots. So yeah, so it's pretty deserted out there right now.
Mm-hmm. So how do people react to this lockdown?
I would say, I mean, there are three classes of people in India, right? Rich class, middle class, and the poor class. The top two classes don't have much of a problem right now. They're happy to stay at home. But the poor class, which depends on daily wages, they are much more heavily affected. They are struggling for their daily livelihood. So it's like, a mixed emotions inside the various strata of the society.
Mm-hmm. So, doctor, what's the percentage of people who are having financial struggles at the moment?
I mean, in India, I would say about 35 to 45% of the people are below the poverty line. I mean, granted, a good chunk of them are in rural India. The rural India is not as badly affected, but still, there is a very sizable percentage of that in urban India. They're very badly affected. So those, they need help, and without strong support from the government and the society, they would find it very difficult to manage this.
Mm-hmm. So apart from the financial struggles they're having, are there any other factors that make it hard for them to get through this tough time?
Yes, I mean, like there were some recent, scattered incidents where people came out onto the streets to, want to leave the city to their native places and so on. So, apart, what I gather is, apart from the food and supplies, I understand that they're also finding it very difficult to stay inside their residential units, which are very small, like a small room you could imagine, and there are, I understand, about 4 to 6 people are put up in those rooms. It's their house, but normally during working days, most of them go out to work and they just come back to sleep. But now they're having to force to be inside that small area, so many people throughout. So that is probably not playing well with them. So I mean, it's understandable. I mean, nobody would be able to stay inside a room like for a continuous period of time. It would almost feel like a jail.
Mm-hmm. Yeah. So now they're not working. Are they getting any financial support from any organization?
It's mixed.
Mm-hmm.
I would say the government has the right intention, and in fact, it has tried to allocate a lot of money and tried to also raise a lot of money from people from donation.
Mm-hmm.
But executing it has been a massive challenge. Getting the money, allocating food supplies is one thing, but actually making sure that that reaches the people, that is been a massive challenge. What I understand is there are a lot of places where people are being helped. The government staff go house by house, give supplies and so on. It happens in a lot of places, but there are still a lot of places where this doesn't happen. So and those places are quite a lot. So this is a massive challenge facing the government as well as the society. So it's been a mixed bag. A lot of people are getting help, but then there's a very sizable percentage that is not getting help either. In fact, we have some areas nearby, which I would tell you a bit more in detail later when we go forward.
Mm-hmm. All right. So, and then how do these people who are having financial problems react so far? Have they voiced their opinions on their struggle?
Um, I mean, right now, I mean, we are in the second phase of the lockdown. The first phase
Mm-hmm.
was for 3 weeks, and for the most part, even those people who don't have much,
Mm-hmm.
they are willing to, they were patient. They
Uh-huh.
understood. They didn't have much supplies. In fact, I have one such community right next to my workplace, which is close by, and I talk to them, and they understand. They don't have much supplies at home, but they put up. But
Mm-hmm.
now, since yesterday, the lockdown has been extended, so those people are becoming more restless. Like, oh, now this is going on for another 3 weeks, and who knows what will happen after that. So there's more uncertainty and more restlessness creeping in right now, I would say. But if the government and the society reaches out to them right now, say that you guys, no problem, you stay at home, we'll give you supplies. I'm sure they'll be okay. They will feel relaxed. But the longer it takes for help to reach them, the more restless that they may become.
Mm-hmm. Mm-hmm. Um, do people take precautions?
Yes, yes,
Mm-hmm.
and even when the lockdown was announced, even before the government said anything, a lot of people started wearing masks on their own. Uh, they, the government already started telling them, to wash your hands frequently, like if you go
Mm-hmm.
out and come back, wash your face and so on, keep soap and disinfectants at home and so on. So those things people follow. And a good chunk of people, I would say, have become very sensitive, and they are trying to be very clean and so on. But then there is another section, which doesn't pay much heed to these things. Like, India is notorious for having unclean surroundings in public places, particularly in cities. People have a habit of spitting on roads. So even today, when I went out, I could see spits on the roads. So this to me is unacceptable. This is a very bad habit to have. Who knows? Maybe they need a big pandemic like this to change their mindset. So there's a good percentage where the bad habits still continue, but there's a good percentage where that people are really being conscious and taking a lot of precautions as well. So you
Mm-hmm.
see both, but
Mm-hmm.
the bad habits need to come down drastically, I believe.
Mm-hmm. Mm-hmm. So since the lockdown began, how have people been relying on to get daily necessities?
Um, so, like a lot of people work from home, those who go to offices and so on. So their salaries and so on have so far not been affected. But there are some sections which may see salary cuts and so on going forward. And like I said, obviously there is a poor strata where
Mm,
the moment the lockdown was imposed, they're not getting any money. So the supplies, those who have money, they're able to go to the markets, buy things that they need, and bring it to home. And actually,
mhm,
I would say, they are quite enjoying the lockdown, staying at home, making food,
mm,
spending time with
mm,
family, and so on.
mm,
So they're not complaining much. But
mm,
but there is another section where they're not able to get supplies. So they obviously feel the pinch a lot. But a lot of people, I mean, the middle class strata of the society, a lot of people are able to work from home to a certain extent.
mhm,
And uh, and the government has asked the companies not to cut their salaries or not to lay them off.
mhm,
So that so the companies, the organizations have not laid off people so much so
mhm,
far.
mhm, mhm,
But this may change going forward, because even businesses have a certain limit. I mean, it's not like they're going to have money and not give to people. So
mm,
there are a lot of
mm,
small and medium enterprises who may not be able to provide to their employees for too long. So, and as for the supplies themselves, the grocery, food items, I would
mhm,
say it's available. It's
mhm,
available outside in the market. People are able to go out and buy it. Um, so there is, the food supply chain is reasonably well taken care.
mhm,
But there are some problems there as well. Like, even though in a lot of places, the grocery stores and the vegetable markets are managed well without too much crowding, but there are a lot
mhm,
of other places where the 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 police and others are not able to regulate crowd. There's a lot of
mhm,
crowd. So me, there is one supermarket, grocery supermarket nearby. It's always crowded, and not I've not gone there at all since the lockdown was imposed.
mhm,
I've been to the vegetable market only twice. That too, I went there when the crowd was less. I'm scared to go to the vegetable market. It's
mhm,
always often it is crowded. At least in my locality, they shut it down for a few days because they found some cases in the nearby residential area, and they just opened it again today. They have distanced the shops much more
mhm,
now. The
mhm,
crowd is okay now there.
mhm,
I can go to the vegetable market now. So
mhm,
the vegetable markets and the grocery stores, until now, I was actually scared to go out.
mhm,
But I have been trying to get things online,
mhm,
and unfortunately, it's not been easy.
mm,
Online vendors, they were making great business before this pandemic situation came, and I was hoping that they would be well prepared at times like this. But shockingly, they have disappeared a lot. So
mhm,
my regular online purchase, grocery purchase vendors, they're not able to deliver at all, and it's been a massive disappointment. Only
mhm,
Amazon and a few other vendors are able to manage it well, and they also take time. But it is okay. At least I don't need these items like in 2 3 days. Uh,
mhm,
they're coming in a week, which is okay. So that is how I've been getting my online groceries so far.
mhm,
But the online ordering has been a massive disappointment. In my view, what I feel is that uh, these, I mean, the government and the e-commerce vendors should have been well prepared for this before this thing came. I mean, I can understand China or Italy being taken by surprise. Oh God, we suddenly got this disease. But countries like India have been watching this unfold over the world. I mean, around the world for over 3 months. They should have known that this could happen here, and they should have taken measures like, okay, if we impose a lockdown, how are we going to make sure that online deliveries could be done? Like for example, in my municipality, a suburb of Mumbai, um, right now, last week, the municipality was taking measures to engage even the local vendors to enroll in online delivery systems, which is a very good thing, and I appreciate that. And it could be very useful. I mean, you don't want people to go to market physically. If somebody can come and deliver it to your home, that would be much better. And it is very good. And not all municipalities are taking such measures, and I appreciate that. But it leaves me wondering, why was this not thought of a month back? Uh, I mean, a lot of municipalities, cities, towns, local civic bodies could have been prepared for such things. Like the day after lockdown, all these online delivery companies, they're all wondering, oh, we are not being allowed to go out. But why is it like that? I mean, we could have anticipated the lockdown, and we could have right away said that online deliveries, food deliveries, whatever it is, they would be exempted. They are very crucial to deal with the situation. Those sort of things. We could have been prepared. Then other now if that had been the case, we won't see crowds in the local grocery stores and supermarkets, and
Mhm.
and it is not fun for anybody to go and stand in the crowd. If given an option, I'm sure all these people would like to do online delivery. So that's the situation with supplies.
Mhm. So, doctor, I have a question. So, the online deliveries are not doing well because the companies do not want their staff to deliver things um, for fear of getting their staff, you know, impacted.
No, I mean, that may be part of the reason, but I don't think that is the main issue here. The main issue
Mm,
here was the day the lockdown was imposed. Uh, Online vendors like Amazon and Big Basket, who
mm,
were about to come out to deliver their existing orders, they
mm,
were stopped. They were not allowed to serve in the streets. Like they were not allowed to come out, and they were all suddenly required to talk to the government and obtain permits. So that became a lengthy process. As a result, everything went into a sort of a standstill. So I mean, that interaction between the government and the online vendors had not happened. A clear path was not charted out. Otherwise, I'm sure people would want to work because they have the option to wear gloves, face masks, and all those things, and they need money. I mean, in fact, as I understand, these delivery executives and the Ola, Uber rental drivers, they're all stuck at home without income, and I'm sure they want to work. Is that we have to facilitate them to do these things. I believe online vendors like Amazon and Big Basket operating at full scale, even though there will be a lot of their executives out on the streets, that is much better than having crowds in supermarkets. I mean, I
mhm,
understand we are exposing the delivery executives as well, but
mhm,
overall, if you look at the overall exposure, that may be better than crowds with the online. And I'm sure that the delivery executives want to work because otherwise they are left without income.
mhm.
So,
I see. Mhm. All right.
yeah.
So, what are the challenges arising from social distancing in India, apart from the problems you mentioned about?
Challenges with rising from social distancing. Like I said, for the poorer community
Mm,
in urban slum areas, it's very difficult for them. Like 4 to 6 people stay in a single
mm,
room. That's
mm,
claustrophobic, so they're not able to do that.
mhm,
The other middle class society, I think they are suffering from boredom, and some are even suffering from mental depression.
mhm,
Sometimes for others it may seem funny, but it is true. It is happening. People are finding it difficult to stay inside all the time. So in the middle class society, that has been a challenge, and 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 overall, I think it is. There are a lot of people are worried about their work and economic activities as well. They are
mhm,
they're not worried about what is happening right now, but they're worried about the repercussions
mhm,
in the future.
mhm,
So so they all, I mean, a lot of my friends I talk to, they want to go to work. Yeah. So for the among the poor strata of the society, the urban poor,
mhm,
obviously, like I said, staying inside a small room, 4 to 6 people, that is extremely difficult to manage.
mhm,
Um, and you wouldn't believe that how crowded the slum areas in Mumbai could be. It's
mhm,
unbelievable. So to manage that for too long a period may be difficult. I mean, maybe perhaps they should be given some other place outside. Maybe they should set up some camps, shelter areas or something. Maybe that should be done. Yeah, I mean, these are things that I could think of. There could be other things which I may not be aware of, but this is what I know so far.
mhm. So at this point, the number of cases has reached 10,000 in India.
Right.
So in terms of medical supplies, facilities, how is it going there?
Um, the government is saying that they have enough supplies, kits to deal with whatever cases are being reported right now, and
Mhm,
uh, and I tend to believe that. But my concern is, what if this thing, blows out of proportion? What if instead of 10,000 we have 10 lakhs?
mhm,
Uh, are we prepared for that? Do we have medical supplies for that? We don't have the details. In India, you don't like get all these concrete details from our administrators. So I frankly don't know. But
mhm,
but one thing for sure, the the medical staff, the doctors, the sanitation workers, and the researchers, who do research on these medical lines and so on, they've been putting in a massive effort. It's unbelievable how they work. So in terms of the human resources, I'm sure there's a great spirit, and we have enough people, and there are a lot of doctors in India and so on.
mhm,
So that is there, and hospitals also we have a lot, but the supplies, kits, that is a bit of
mhm,
an unknown. Only the government knows, and I don't know if we will get a clear answer on that yet. I
mhm,
think I think India is a country which can't afford very massive, extensive testing. Social
mhm,
distancing, maybe it's most effective way of containing the disease. We're not like Norway or Sweden, which can do like thorough testing on everybody. So
mhm,
social distancing is the number one and most effective option in my view.
mhm. All right. So, how will COVID-19 affect India in the long run?
How will it affect? Um, I think we have a. I think it depends on how we react, the government as
Mm,
well as the society. In my view, um, if the lockdown becomes sustainable,
mm,
then I think India can come out of this very well.
mm,
Uh, you extend the lockdown, you limit the people who come out and work, even maybe a phased release of the lockdown and all that. If we do that, then things could be really good in future. But doing this would be a massive challenge. First and foremost, we need to take care of the poor strata of the society. Help needs to reach there. Um, that is a massive executive challenge, and that needs to happen. If that doesn't happen, then people are going to become anxious and restless, and they're going to put pressure on the government, and we are going to end the lockdown in a haphazard, incomplete way. And if we do that, then there is a big risk of second or third spread, even if it seems like we have stopped it for now. So it depends on how the government and the Indian society reacts. It has a choice. It's still in our control, and how we react, that matters a lot. If we take right decisions, if we manage it well, then we can do it. Otherwise,
mm,
a country like India, if community transmission happens, it would be a massive disaster. I mean, forget US. India, it would be one among the worst affected countries,
mhm,
because the population is huge here. So yeah, there is a chance, and it depends on how we how we adopt that choice.
mhm.
Yeah.
Yeah, and from your perspective, how will this pandemic affect the world in the long run?
I think this pandemic has already proved to be a game changer. It has
Mm,
exposed a lot of weaknesses in the global society. First, look at the healthcare systems around the world. They've been a massive failure. Uh, we hear about healthcare system being weak in developed, even in developed countries like US and so on. It's always brushed aside. But now you see the difference. You compare the healthcare system of US with a country like Canada or even Korea, for example. Uh, there's a massive difference. So just because you have the resources doesn't mean that you enact things properly. A lot of things we tend to take granted. So those things are exposed a massive deal. And the way we treat nature, I mean, suddenly we hear the air atmosphere being very clean, the rivers are clean, and it is a massive eye opener, and it goes to show that how much the human beings are messing with the environment, um, so there are a lot of things like this that could prove to be an eye opener, but we as a human race, are we capable of embracing all the changes? I'm not sure. I think we may
mhm,
degenerate again, and
mhm,
again, there is a choice in front of us. It depends on what choice we want to take up. And there are a lot of other things like the impact it will have on the globe, on a global level. I would again, other things I'll split it in terms of developed countries versus developing countries. So developed countries, like I said, they have to, take a hard look at their healthcare systems, their priorities. They have the resources. How much do they want to affect the environment and so on? Those sort of things they should look at. I mean, healthcare difference. Compare Germany with US, for example. Something, those sort of things for them to work out. But there are a lot of developing countries. we have a whole host of other problems. Like I'll mention a few points relating to India, and it would be common to a lot of developing world as well. Like India, if you look at the resources, like the policemen or the judicial staff for per capita is among the lowest in the world, and that would be the case for a lot of developing countries. And and in times like this, you realize how helpless police is. I mean, police can't be present everywhere. And I could tell you, like last month, sorry, in the last 2 weeks alone, 35,000 tickets were issued in my own state for violating social distancing. And you could imagine the massive challenge facing them. So the country has to realize we need to employ more people to govern, like police staff and so on. And and both developing and developed world should realize the local infrastructure must be strong. US has all the money, but they don't have supplies because they have outsourced all their manufacturing units somewhere else. And countries like India are talking about make in India, but they're still having to plead with developed countries for technology. Like we don't design in India, we don't develop in India. We only want to make in India. Countries like India, they invest very little in R&D. Tomorrow, okay, India may still be able to manage it well with social distancing, but which countries are likely to develop vaccines first? The countries that develop it, that invest in R&D, right? US, China, Europe, Australia, countries like those. So they will have an upper hand. So uh, we need to have a strong local infrastructure. I think this is something all the countries must realize, that as good as global market is, global economy is, your local infrastructure must be strong. You need to, you need to invest something to develop in your own places, indigenous products, develop technologies. You need to, encourage people. You need to see how the government, how the social revenue is structured. No point paying $20 million for sports stars and doctors getting much meager amount and researchers getting, you need to increase funds and resources there. You are in, you know, you need to, like, I mean, this may not be the only case. What if tomorrow there is an oil embargo? Then you would you would plead for oil from other countries. So this is a wake up call uh, on so many levels on things like this. You need to make sure that you are, I mean, the locally you are sustainable. That matters a lot, and that brings into focus agriculture. We take agriculture for granted. We need to support the agricultural community much more. In India, you see a lot of farmer suicides. So it it brings so many of these things into limelight. If we don't realize this now, we will never realize it.
Mm-hmm.
Yeah.
Yes. So, doctor, personally, has this pandemic changed you in any way?
Um, Not much really. I'm a person who has always been very comfortable with being alone. I don't feel lonely. This has been the case ever since I started doing my higher studies, master's, PhD. So I've tuned myself to be inside house. I can happily, uh, I can happily, even though I love to go out, I can happily stay at home for many days. Personally, it's not a big problem for me. The only change I have to adapt is managing food supplies, grocery supplies. I am scared to go to the supermarkets which are crowded. So I'm just waiting for my online orders, and I am, managing my rations inside the house. My most common food since the lockdown is bread, omelette, French toast, either this or rice with pulses. So the vegetable intake has gone down, but so that's the only major change. Otherwise, and I'm not able to operate our R&D production plant at the full capacity. It is stuck halfway. We are able to keep it running at the minimal level. It has a lot of operational glitches that need to be repaired. We're not able to do that. That bothers me a little bit, but that's that. Other than that, I am okay. But my concern is a lot of people around the world are not. So yeah.
Yeah. So, doctor, is there anything else that you would like to share with us? Any particular thought that we didn't cover?
Hold on, I made some notes. Let me just quickly go
Yeah.
through it. If there's
Yes.
anything else.
Mm-hmm.
Yeah, I just wanted to give a shout out to all the frontline staff, medical, police, researchers, sanitation workers, and so on. What they're doing is unbelievable, um, and I feel that the administration, the governments, they need to be on their toes. It is very easy to announce lockdown, but very difficult to enact it. So my request is that they should coordinate those at the top level administrators. They need to coordinate well. They need to be more prepared so that the most vulnerable community is not affected. Help reaches out to everybody. So that preparation, that is, I would humbly plead for that to everybody concerned. Those in those sort of positions. That coordination and effective reaching out is needed. I really feel sorry for countries like US, Spain, Italy. It really pains my heart to see what's happening there. Um, some of these countries are my most favorite. I mean, I lived in the US for 10 years. Italy is the most beautiful, loveliest place I have visited in the whole world. Barcelona is my most favorite city. So it really pains my heart to see all those things. And another thing I wanted to point out is when the economy goes down like this, money doesn't matter, supplies matter, food matters, agriculture matters. So we need to make sure that the agriculture sector is extended full support, not only now, even going forward. Even now, in some parts of the country, I heard that the farmers have their produce, but there is nobody else to procure them. They are lying waste and they're going waste. So those sort of things we should address because farmer is the king now. We may have all the money, but if we don't have uh, food supplies, then it becomes worthless. So the agriculture and the supply chain needs to be prioritized. It needs to function very smoothly now, and going forward also, I think farming community should be kept as one of the topmost priorities. I mean, whatever problems we have, all over the world, not only in India, not only in developed countries, everywhere, farming and agriculture should be prioritized a great deal. And I want to stress that we need to strengthen our local infrastructure. That means our local capabilities, designing, R&D, product development, and all that. That that I want to stress again. So these are things in my mind that are foremost considered forward. Yeah.
Mm-hmm. Wow, thank you so much, Doctor. We really appreciate your time, and it's great listening to you. I think a lot of our listeners will benefit from listening to you. Thank you so much for joining.
And before we end, I want to ask you, like, can you give some key takeaways because China has managed this well? What sort of advice takeaways can you give from what you've seen from your locality, from your country, that could
Mm.
be useful for others?
Well, I may not be the best person to, to share the, how to say, um, what has been done to make it work. But based on my observation, I think how the whole country is working together from all the levels uh, to make this, to get through the tough time. I mean, cooperation.
Okay,
I think
okay, yeah,
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 that's the key. Yeah.
yeah, I think, yeah, that is. I'm glad you mentioned that because it's very difficult to do that.
Mm-hmm.
It's very easy to say things, to even
Mm-hmm.
gather funds, but to make this happen, that's a massive challenge for everybody. And yeah, I agree. That is something that's been done very well in China, and I think a lot of us should learn from it. And I'm glad that you are having this show. I listened to a few episodes myself. I got to know what's happening around the world, and particularly at this time, lockdown means people are not able to, really go out and see and talk. So this, I hope this your show would be a good venting point for that, and hopefully times would get better, and we would be able to talk about more glorious, interesting things in future. Yeah,
Yes. Okay. That's
thank you, and I wish the best for everyone all around the world.
yeah. We hope for the best. Thank you so much, doctor. Thank you. Bye. Thank you.